Hey everybody, Tim Weyant, clinical specialist, physical therapist here with the Aspen Center in Coral Springs. Today we have...
Hi, I'm Ryan Miller. I'm also a physical therapist. I'm the clinical specialist here in the Orlando area.
Awesome. Hey Ryan, how you doing?
Doing great, Tim. Good to see you.
Likewise. So today's video is for anybody out there reaching out for questions about what is the Aspen treatment, what can I treat, issues after cosmetic or plastic surgery, even reconstructive type of surgery, and types of services that Aspen offers. So let's jump right into it. So Ryan, why don't I have you start? What is probably one of the most common things that we see and can treat after plastic or cosmetic surgery?
The main issue that we see here in the Orlando area, and I think it's the same down south, is capsular contracture. We treat a lot of patients.
And for anybody who doesn't know what that is, tell everybody what capsular contracture is.
Capsular contracture is a condition where after breast augmentation, a hardened and fibrous capsule forms around the implant, causing it to be hard, high, and often painful.
Awesome. Thank you. Also, women who have had breast reconstruction. So women who go through mastectomy, expanders, final implant, you can actually have the same issue of a hard, high, painful, asymmetrical breast during the expander phase and even on final implant. Awesome. Other things we see, I would say our number 2 is liposuction fibrosis. Would you agree?
Yes, sir. Liposuction fibrosis would be our second diagnosis as well.
Awesome. So patients who have liposuction, fat freezing, pretty much anything in which tissue, fat specifically, is removed may suffer from liposuction fibrosis, which is really where the tissue that is left remaining becomes irritated, inflamed, and instead of turning into good tissue, basically forms scar tissue. And what most patients will see is lumpy, bumpy contour irregularities. It almost has that washboard sort of look to it, but not the washboard we're looking for. And in some cases can be painful in those knots. So Ryan, talk a little bit about your experience treating fibrosis, how you do what you do.
Well, what we've seen a lot of here with our fibrosis patients is tissue that's hardened to a point where the contours of the skin in the abdomen become irregular. There's fibrotic tissue that leads to lumpy and bumpy areas. What we do is we use the Aspen system to allow for ultrasound treatment that then can help to change that tissue and allow for our manual treatments to be more effective. We will reduce that fibrous tissue, allow for more supple and pliable tissue, which then allows for that contour to become smoother and more aesthetically pleasing.
Awesome. Thank you. Yeah, so it is a combination of proprietary technology, techniques that we've developed and actually hold US patents on. And it's a amalgamate, if you will, of a bunch of different hands-on technologies as well as education. We also teach the patients how to help themselves by doing a home program. So on days they're not receiving the treatment, patients will actually get homework and be able to do that. Okay, so let's talk about other areas of interest. So Ryan, have you guys dealt with, let's say, facial fibrosis? Have you seen anybody with face issues like scarring, lumpy, cording, banding, platysmal issues, and what have you seen with that?
Yes, as a matter of fact, we have. I have a patient that is still currently working with us to some extent. He's kind of finished the in-clinic portion of our sessions together. And we have been working quite a bit on reducing cording and fibrosis tissues that have formed after having some plastic surgery to his chin and jaw area. And that's been very successful. We've been able to get quite a bit of that mass of tissue to reduce to get a little bit more of a normal contour to his chin and jawline.
Perfect. Yeah, so down south here, same thing. We've seen a number of patients who have developed lumps or knots, especially after hematomas, almost the cord-like platysmal band that we see, which is just a myofascial restriction and scar-like tightening. General issues of just basic mobility. So some people, when their face gets these scarring or infections or hematomas, it's difficult for them to turn their neck or move their head. So getting that patient's range of motion back, as well as the cosmesis of just looking better. I mean, a patient who has a facelift doesn't want to look lumpy and bumpy and have strings and cords all over them. And this can apply to a traditional facelift. It can be a neck lift. It can be a chin implant. It could be fat removal from any of the areas, and even patients who have fillers. So one of the interesting things about the Aspen treatment is patients who get fillers to the face, really fillers anywhere, can actually develop a capsular contracture-like syndrome where bacteria gets into the filler, causes the filler to hard, and turns into almost like a straw-like or a bump-like substance under their skin. So with our treatment, we can address the bacterial component of the cause, smooth and flatten that. So whether it's a fibrosis bump or a filler, we've had some pretty good success with that. Ryan, in your experience treating your patients up there in Orlando, how's the treatment? Do patients report to you that the treatment is extremely painful, that it's uncomfortable? Have you ever had a patient not do treatment because they said it's just too uncomfortable or painful?
No, we haven't. Some of the manual techniques are aggressive. There's no doubt about that, but the pain associated with those techniques is no more than what someone might report after massage therapies and those types of things. The penetration to the tissue is important as far as the treatment application. So there is, to some extent, going to be some aggressive massage therapies and the like. However, the majority of patients, if not every single patient that we've seen here, has had an overall reduction in pain symptoms after treatment. So during treatment is not painful per se, but can be a little bit uncomfortable. But post-treatment, that is almost 100% less pain than starting the treatment.
Great, thank you. Yeah, and great analogy. You know, as licensed physical therapists, there's numerous conditions that we treat on patients who, you know, the goal may be pain reduction, but sometimes in order to make the pain go away, we got to stretch or loosen something. Shoulder patients, knee patients, orthopedic surgery, you know, patients come in, they're stuck, they're not moving, they're in pain. But the second we get them mobilized and moving, so whether it's fibrosis, tummy tuck, facelift, breast implant issues, the treatment's goal is to relieve that pain. And interestingly, even with pain medications and injections, patients have these pain-involved syndromes, very common in breast augmentation or liposuction and tummy tucks. You know, patients get MRIs, it doesn't show anything. They go to their surgeons, the surgeon doesn't really know what's going on. And when we take a little bit deeper of a dive, we realize this is just locked up tissue that's not moving. And once we move it and loosen it, any discomfort associated with that treatment immediately results in relief in it. So that's actually one of the first benefits that we see with a very high level of success, where pain is typically statistically going to be one of the best outcomes while softening, loosening, and making things look better. Any other conditions or treatments or components, Ryan, that you guys see up there that you want to share with anybody that may be interested? Are there any conditions like maybe with the illuminizer, LED, or electrical stimulation that you treat or suggest that you want to talk about?
One of the things that we have used a little bit is the illuminizer, the light therapy. That is very effective in increasing the healing properties that our body has normally. And that has been very successful, even in conjunction with some of the other diagnoses that we've been speaking about too, to help the body to heal itself while we help the tissue to remodel. I think that's an important piece of what the Aspen system does. This is a physical therapy-based treatment protocol, and we use physical therapy treatments to treat patients with aesthetic surgeries and other plastic surgeries. So I think that's an important aspect of what we do.
Definitely. And agreeable on that. I think the light therapy, the LED, is very, very powerful, especially for patients who had issues with wound closure, hematomas, seromas, post-infection necrosis. One of the byproducts is when patients do fat transfers, you lose about 30% of your volume. So it's almost like, you know, you bought a car with 4 tires, but after you drove the car off the lot, one of your tires fell off and you got to go get another tire. The LED light does help maintain volume of fat as well as nerve regeneration. So patients with sensory issues, patients who lose sensation in their nipple, patients who lose sensory issues in other areas, the LED is very good for that. And the other component being the stimulator, which is our electrotherapy, not electrocution therapy, electrotherapy. Electrical therapy is a whole different type of rehab. We don't want to get into that. But electrotherapy utilizes electrical currents to be able to do lymphatic drainage, pain control, and numerous other things. So the aspect of what all the Aspen system offers is pretty wide. So the most important part is, how do patients get the Aspen system and where is it rendered? So Ryan and I are both licensed physical therapists practicing for 22 plus years. I think we just dated ourselves. Sorry about that, Ryan. But as physical therapists, we are experts in soft tissue, physiological issues, issues of the body and the tissue. We're not medical doctors because we don't use medications to do it. We're not surgeons, so we don't do surgery. Our specialization in that. So anybody looking for this type of treatment, it's important that you seek out an Aspen licensed provider. There are numerous types of clinicians out there, chiropractors, other physical therapists, massage therapists, even doctors that utilize certain technologies, but our specific interest being cosmetic, reconstructive, and plastic surgery, and our training and our specialization is specific to the Aspen name. So if the center itself does not have an Aspen licensed certified professional, like both Ryan and I, you're probably not going to get the type of treatment that we're discussing or the results that you're seeing here on our platform. So Ryan, hey man, good to see you. Keep up the good work, getting lots of great reviews and results from you guys up there. So anybody looking for Aspen treatment, breast contracture, liposuction, tummy tuck, facelift, take a look at the banner below. It's got the 877 number on there. We will coordinate location, getting you to the right professional, making sure you get the right treatment. And don't forget, we also offer virtual evaluations. So anybody watching this from anywhere in the world, if you have a question, if you want a second opinion, maybe your surgeon said something and you want another clinical professional's expertise on this, call us up. We can do a virtual evaluation, look at you from anywhere in the world, give you a second opinion. And if we can't help you, we can tell you what a plan B could be, or give you alternates of what may be a better solution if we're not the solution. So Ryan, thanks again, buddy. We'll see you soon. And Tim Weyant, Coral Springs signing off.